everyone, Namaskara. Today in this video, let us deal about the first topic of Roga Nidana Evam Vikriti Vijnana from the second paper, that is Agnimandhya. The topics to be covered are, firstly, as usual, we will begin it with the introduction, then Paribhasha, what do we mean by Agnimandhya, Marga, how it gets manifested, Nidana Panchakas, that is Nidana, Purva Rupa, Rupa, Upashaya and Samprapti along with the Samprapti Gatakas. Patya and Apatya, the dietary regimens to be followed and which are not to be followed, that is which are to be avoided. Then we should discuss about the differential diagnosis. At last we shall look into few references which we have used to learn in detail about this disease, that is Agnimandhya. To make this study still more interesting, I have included a case study. That is in the beginning of this video, that is just in the upcoming slide, I will give you a few note points regarding a case study. And as we go through each subtopics, you guys have to keep on assessing the case study which I will have given in the beginning. And at last, I will give you the diagnosis made by the physician in this case study, and we shall see how they have went through the process of diagnosing and treating the patient. So let's begin it. With a case study. Here is a case study of a woman of 59 years old. The history of present illness was, she presented with the complaints of anannabhilasha, that is not having the desire to have food, amla pitta, she was suffering with hyperacidity, adovata and urdhvata, that is she had overpelching and the flatulence. Then she had general weakness, tachycardia, that is 100 beats per minute, more than 100 beats per minute, and constipation, and she had the disturbed sleep also. The chief complaints which she presented, she had anannabhilasha and adovata, urdhvata and daurbalya in especially the limbs. Means she was not able to do her routine works. And these were the complaints she was having. That means she was suffering from these from last 3 weeks. And the past illness of the patient was, she was a constant patient of the diabetes mellitus, type 2 diabetes mellitus and hypertension, as she had the tachycardia. And then hypothyroidism. This is the major cause. What for this was the major cause, I'll say at the end of the video. And then CHD, she was suffering from the coronary heart disease, and the medication which she had taken was the allopathic medicine. So, these problems had reoccurred to her. So, and the family history was again in her family they were suffering with the diabetes mellitus and the hypertension. The prakriti of this woman was the Vata Kafaja, that is Vata Pradhana Kapha Prakriti she had. And what was the diagnosis of that physician, and what why is it related to the Agnimandhya, we shall discuss at the end of the video. Now let's begin it with the introduction. What do we mean by Agnimandhya? Agni refers to the Jataragni and Mandya refers to the lacking capacity or the diminished power. As usual, it is related with the indigestion in the modern terms. In Ayurveda, they call it as the diminished power of the digestive capacity, that is the Jataragni. Then there is a shloka, Rogaha Sarveapi Mandagnam Sutara Mudarani Cha, from the reference Ashtanga Hridaya Nidana Sthana 12th chapter 1st shloka, which means that Agnimandhya remains as a eternal causative factor or the Purva Rupa. Agnimandhya itself is a Purva Rupa for many other diseases. It is a base for manifestation of the several diseases. In other words, Mandya means it can be referred as the diminished power of digestion and also the transformation pertaining to the Sapta Dhatus. We know that there are 7 Dhatus in Ayurveda, right? So, there are totally 13 Agnis we consider in Ayurveda, and among them the Sapta Dhatva is also one among that. So, maybe there might be the diminished power in the transformation of the Dhattvagnis, and also the Jataragni diminished. It can be considered as Agnimandhya. Coming to the Paribhasha, that is the definition of Agnimandhya. The disease in which the power of digestion, that is the Agni, diminishes to result in the onset of various symptoms is called as Agnimandhya. As I've said, this itself acts as a Purva Rupa for manifestation of so many diseases. So, this is a condition in which the power of digestion, that is the Jataragni, diminishes. So, then this disease is also called as Bishak Moha Kara Vyadhi, means it is very much difficult to diagnose as well as to treat. So, this is deceptive, means it misleads the physician also in some conditions while the diagnosis. And due to the Jataragni Mandya, the nutrition to various bodily elements hampers due to which the total body organs and the systems becomes feeble. So this is a major culprit for manifestation of so many diseases, and it is equally important to diagnose and treat it in the beginning stage itself. Beginning it with a nidana. This is the shloka from the reference Charaka Chikitsa Sana 15th chapter 44th shloka. The shloka goes as Abhojanat Ajinat Ati Bhojanat Vishamashanat Asatma Guru Shita Ati Ruksha Sandushta Bhojanat Vireka Vamana Sneha Vibramat Vyadi Karshanat Desha Kala Rutu Vaishamyat Veganamcha Vidaranat Dushyatyagnhi Sa Dushto Annamcha Tat Pachati Lagvapi. So as I said, this is from Charaka Chikitsasana 15th chapter. Firstly, there are three major classification in nidana, that is Aharaja, Viharaja and the Manasika nidana. So we have to classify these nidanas under these three subheadings. Okay. Firstly, Abhojanat is long-standing starvation. We know few people will be doing upavasa and all. So they will. There are more chances that they suffer from the Agnimandhya when they have done it for a long-standing period. So Abhojanat is long-standing starvation. Then Ajirnat means consumption of the ahara which is not compatible to them, so that it leads to the indigestion of the ahara that they have consumed. Then Vishamashanat means having the food untimely and with the irregular quantity of food. So the eating improperly with irregular diet refers to Vishamashanat. Then Asatma Guru Shita Atiruksha Sandushta Bhojanat means having excessive of heavy food which is difficult to digest, then cold items, and then Atiruksha which are over dry means which are who always consumes the fried items and junk foods. Vireka Vamana Sneha Vipramat means improper conduction of the panchakarma procedures, or they might have not followed the proper samsarjana krama as prescribed by the physician. In those conditions, it may become a nidana for Agnimandhya. And then Vyadi Karshanat, they might have previously suffered from any diseases or the surgeries. Then Desha Kala Rutu Vaishamyat means the variation in the climatic conditions or the time of consumption or the Rutu Viparya. Then Veganamcha Vidaranat, suppression of the natural urges. Dushatyagni sa dushto annamcha tat pachati lagvapi means these leads to the hampering of our jataragni, for which we have to consume the lagu ahara which is easily digestible. See, based on my explanation, you guys will have come to know what is to be considered under the ahara, vihara and the manasika. Under ahara, you can consider the abhojanat, ajirnat, vishamashanat, next asatma guru shita, atiruksha, sandushta bhojana. Under viharaja, you may consider the vireka mamana sneha vibramat, because the improper conduction of the panchakarma procedures or the samsarjana karma is a viharaja karna. And the Vyadi Karshana, again Desha Kala Rutu Vaishamya Veganam, again it also comes under the Viharaja Karana. And then Dushatyagnihi, under the Manasika Kalaha, during the mental disturbances also, one will not consume, an individual will not consume a proper ahara according to their bodily needs. So it becomes a nidana for Agnimandhya. The next topic is the Samprapti. Before writing this flowchart, let me remind you about a shloka to be written before this flowchart. That is, Dushatyagni sa dushto annam na tat pachati lagvapi apachyamanam shuktatvam yatyannam visharupanam. That is from the same reference, Charaka Chikitsa Sana 15th chapter 44th shloka itself. Then starting it with the Nidana Sevana. As I have said, the Nidana, that is Aharaja, Viharaja and Manasika. Due to all that persistent Nidana Sevana, it leads to Dosha Prakopa, that is Kapha Pradhana Tridoshaja. And then it leads to the Jataragni Dushti. There will be vitiation of the Jataragni, that is the digestive power. It leads to Jataragni Mandita, that is it hampers the digestive capacity of that individual. Then Apurna Paka of Ahara means there will not be the proper digestion of the complete food which we have ingested, means there will be indigestion, and further it may lead to the Ama Utpatti also, and then it leads to the Agnimandhya, the disease which we are dealing it with. So this is the Samprapti of Agnimandhya. Further, the Samprapti Gatakas. The dosha involved predominantly is kapha pradhana dvidoshaja. I have said in the samprapti itself, there is kapha pradhana dvidoshaja involvement. Then the dushya, that is rasadhatu involvement, is majorly seen, and in some references they are given agni. Further, the srotas involved in this is annavaha srotas. Swabhava of this disease is chirakari. It is chronic comparatively. Means in the morning if the person is suffering from Agnimandhya, in the afternoon or in just in the evening, it doesn't get cured completely. So it takes few days to few months. So it is chirakari. Udbhava sthana is of course the amashaya, where the digestion takes place. Half of the digestion takes place. Then the adhisthana is amashaya, and in some references they are given the grahani, as the complete digestion does not take place in the amashaya itself. It further continues to the grahani. Sadhya sadhyata is, it is sadhya, but in few cases depending on the condition it is kashta sadhya. The sanchara sthana is the annavaha srotogata avayava, means wherever it is related to the annavaha srotas, so there the manifestation of this disease takes place. The Srota Dushti is the Sangha, as the Annava Srotas is involved. There are 4 types of Srota Dushti. One among them is the Sangha. So this is all about the Samprapti Katakas. Further, moving on to the clinical features, that is a Rupa. The general classification of the Agnimandhya is Vishamo Vatajan, Rogas Tikshna Pitta Nimittajan, Karotyagni Stama Mando Vikaran Kapha Sambhavat. From the reference Sushruta Sutrasthana 35th chapter 30th shloka. See, Vishamagni is due to Vataja Pradhanatva, Tikshnagni is due to Pittaja Pradhanatva, and Mandagni is due to the Kapha Pradhanatva. So it can be classified into 4 headings, that is Vishamagni, Tikshnagni, Mandagni and Samagni. Samagni is nothing but the balanced state of all the 3 doshas and the proper working of the Agni, that is the Jataragni. So as I said, Vishamagni is mainly due to Vataja, Tikshnagni is due to Pittaja, and Mandagni is due to Kaphaja. So we shall look into each clinical feature of these Agnis. The first one is the Vishamagni. The shloka goes as Yaha kadachit samyak pachati, kadachit atmana shula udavarta adisaraha, jatana gaurava antrapujana pravahanani krutva sa vishamaha. From the reference Sushruta Sutrasthana 35th chapter 24th shloka. It means that Yaha kadachit samyak pachati. Sometimes there will be the proper functioning of Jataragni. Kadachit. Some other times there will be Admana, that is the abdominal discomfort. There will be severe pain in the lower abdomen. Shula, it also refers to the abdominal pain. Udavarta, that is the upward movement of Vata in the koshta. Atisaraha, there will be diarrhea. Jatana Gaurava, heaviness of the abdomen. Antrapujana, the gurgling sounds present in the abdomen. Pravahanani, means there will be straining for the evacuation of stools. Krutva sa Vishamaha. These are the clinical features and the characteristics from Vishamagni, and it is mainly caused due to Vataja. The second one is the Tikshnagni. Yaha prabhuttam apyupayuktam annam ashu Pachati Sa Tikshnaha. From the reference Sushruta Sutrasthana 35th chapter 24th shloka, from the same reference. In this case there will be the state in which there will be hyper functioning of the Jataragni. So there will be quick digestion of the food ingested, means even if they take more quantity of food also, it gets digested very quickly. It is mainly due to the Tikshnagni, which is also due to the Pittaja. So, Yaha Prabhuttam Apyupayuktam Annam Ashu, means which gets digested very quickly. Pachati Sa Tikshnaha. From the reference Sutrasthana. Then next one is the Mandagni, that is Yasvad Alpam Upayuktam Udara Shiro Gaurava Kasashwasa Praseka Chardi Gatra Sadanani Krutva Mahata Kalena Pachati Sa Mandaha. From again the same reference itself. It means that the state in which there will be hypofunctioning of the Agni, means there will be even if they take less quantity of food also, it takes more time for digestion, and it is due to the Kaphaja Pradhanatva, means Yasvalpam Apyupayuktam Mahata Kalena Pachati. It takes more time for digestion of the ingested food, and the clinical features observed are Udara Shiro Gaurava, means there will be heaviness in the Udara, abdomen and the head. Then Kasa, Shwasa, Praseka refers to the excessive salivation. Chardi, there will be vomiting sensation as there will not be the proper digestion. Gatha Sadhana means there will be lassitude, that is weakness of the body. Krutva, it does all this, means Mandagni does or causes all these clinical features. It is called as Mandagnita. Last one is the Samadhi from the reference Madhavanidana 6th chapter 24 shloka. It is also mentioned in Charaka Vimanasthana 1st chapter 25th shloka. The shloka goes as Udgara Shuddhir Utsaho Vegotsargo Yatochitam Lagutaha Shit Pipasa Cha Jina Aharasya Lakshanam. It is also the shloka mentioned in Jina Ahara Lakshana, when Samadhi is nothing but the state in which there will be proper functioning of Agni and the doshas will be in balanced or equilibrium state. The clinical features are here: the Udgara Shuddhi, the clear belching will be there. Utsaha, there will be enthusiasm in working. Vegotsarga means the natural urges will be timely evacuated from the body. Laguta, lightness of the body will be there. Shit Pipasa, there will be timely urge of hunger as well as the thirst. So these are the conditions of Samagni person. Then Patya and Apatya, which are to be followed and which are not to be followed. Patya is Lagu Ahara intake, means one who is suffering from the Agnimandhya should take the Lagu Ahara, which can be easily digested, and they should have the restricted diet, means what is to be eaten, how much nutrition is to be taken, that is to be kept in mind. Then Apatya is Guru Ahara, means which takes longer time for digestion. Such kind of ahara should be avoided, and overeating, it should be avoided. This is all about the Patya and Apatya. The various conditions for the differential diagnosis are listed here. First one is Grahani, Rajayakshma, Gulma, and the depression or the Manodainya. And the references used here are Madhavanidana 6th chapter, Charaka Chikitsasana 15th chapter, Sushruta Sutrasthana 35th chapter and 46th chapter, Charaka Vimanasthana 2nd chapter, and Ashtanga Hridaya Chikitsasana 10th chapter. In the beginning of the video, I had discussed about a case study of a woman of 59 years old. I'll just brief it once and continue with the case study and the diagnosis. She had the major complaints, that is chief complaints as Anannabilasha, Adovata and Udvavata and Daugbalya since 3 weeks, and then she had consulted, she was a patient of Prameha, and that too Vataja Prameha, and her Prakriti of that lady was Vata Kafaja, that is Vata Pradhana Kafaja Prakriti she had, and she was a constant patient of Prameha, hypertension and hypothyroidism. As I had said, hypothyroidism was one of the major causes that she is suffering with the Agnimandhya. How come we shall discuss now? See, the diagnosis is the aggravation of dosha is a major cause for the impairment in the Jataragni, right? So, Vata, mainly Vata dosha is responsible for both Mandagni as well as Tikshnagni, because Vayu is compared with Vata. So, to activate or ignite the Agni, Vayu is necessary, that is Vata is necessary. So, there will be proper maintenance of the Agni, that is Tikshnagni. Then, when there will be excessive Vata or Vayu, it leads to Mandagni. Means when there will be much Vayu, then the Agni hampers. So, it leads to Mandagni. So, majorly Mandagni and Tikshnagni for both Vata is responsible. Then, coming to hypothyroidism. Why is hypothyroidism caused? Due to the decreased secretion of the thyroid hormones, right? And the major cause for that is also the less or reduced physical activities. And of course, the reduced physical activities leads to the less secretion of thyroxine, and which leads to the weight gain, means the person becomes obese. So, the weight gain, that is the accumulation of excess fat. What we consider it in Ayurveda, it is nothing but the Medo Datvagni Mandya. Meda is compared with the fat, right? So, when there will be excessive fat accumulation, means there will be Medo Datvagni Mandya. There will be no proper synthesis of the Meda Dhatu. It leads to hypothyroidism. Again, it comes Medo Datvagni Mandya, means Agni Mandya itself. And as I have said, she was suffering from the Vataja Prameha, means her Prakriti is also Vata Kafaja, and she has reduced or lower physical activities, that is Vata is again hampered there. So, due to all that, she had the Mandagni, that is the Agni Mandya. This is the diagnosis by the physician, and again the treatment, we shall not focus much on the treatment, but just to mention here, the physician has prescribed to intake the Manda, Peya and Bilepi along with Anupana, Trikatu and Gruta. As we know, Trikatu, Gruta, all these are the best Deepana Dravyas which enhances the Jataragni or the digestive capacity. This is all about the case study. And before taking the treatment, the Agni of the person was Abhyavarna Shakti. She used to take a reduced amount of the food because she was unable to digest it properly. And Jarana Shakti was again, she was having the Adovata and Urpavata, her Jarana Shakti was also not proper. After taking all the prescribed medicines and the treatment, she again gained back her normal weight and tachycardia had also improved, and she was having the proper consumption as well as digestion of the food. This is about the case study. With this, we have completed our topic Agnimandhya. Stay tuned with Adwitiyah. Lokaha samastaha sukhino bhavantu. See you all in the next video. Till then, take care. Bye-bye.